At this time, I have the privilege of introducing our panelists for this afternoon. Our first panelist, Dr. Melanie Thompson, is executive editor of the Strategy to End AIDS in Fulton County of the Fulton County Task Force on HIV/AIDS. She also chairs the Task Force Prevention and Care Committee and sits on the Executive Committee. She is a member of the U.S. Department of Health and Human Services Antiretroviral Guidelines Panel and the International Antiviral Society's USA's Antiretroviral Therapy Guidelines Panel, which she chaired in 2010 and 2012. She also contributes to the policy advocacy in the U.S. through the HIV Medicine Association, the Ryan White Medical Provider Coalition Steering Committee, and the Georgia Department of Public Health HIV Medical Advisory Committee. Dr. Thompson has had a long history of clinical research. Since 1988, she has been principal investigator of the AIDS Research Consortium of Atlanta, also known as ARCA. ARCA, make some noise. Y'all are here? Is ARCA here? There they go, okay. Where she has led over 400 studies in the areas of HIV treatment, pre-exposure prophylaxis, complications, diagnostics, epidemiology, and hepatitis C treatment. Most importantly, she continuously cares for patients in the clinical practice. Her passion is to contribute to the end of the HIV epidemic through prevention and treatment research, evidence-based policy, and patient care. Would you please welcome Dr. Melanie Thompson. Next, we'd like to welcome Lisa Rowland Labiosa, who has been the executive director of the Grady Infectious Disease Program, also known as IDP, for 5 years. She is a member of the Fulton County Ryan White Planning Council and the Georgia Prevention and Care Council. Prior to coming to Grady IDP, she spent 15 years as the director of primary care section for New York State Department of Health AIDS Institute. Throughout her career, she has developed innovative programs and policy interventions for HIV prevention and care. She has also been involved in the HIV/AIDS work since 1987. She has worked in a variety of settings, including community-based organizations, neighborhood health centers, hospitals, and local government. Ms. Rowland Labiosa has extensive professional experience in diverse aspects of public health and social services, such as program development, strategic partnership development, technical assistance, training and monitoring, policy, program, advocacy, and budget management. She holds a master's degree in public health from the University of Michigan. We welcome Ms. Lisa Rowland Labiosa. Next, we'd like to welcome William, also known as Elder Francis, who is lead servant of Atlanta Faith in Action, a Christ-centered, kingdom-focused ministry, CEO of the AFIA Center, visionary behind William Francis Ministries, and managing partner of the Francis Group, a coaching and consultancy firm. William is an author, life coach, and ambassador for the Black Church, an HIV social justice initiative. His mission is simple: to transform ministry, minds, lives, and souls in order to change communities and the world in which we live. Most recently, he founded The Gathering, a social impact event that looks to transform communities, one life at a time, through poverty alleviation, affordable housing, healthy food, access to quality health care, and job readiness training. The Gathering, just a year old, now serves on average 1,500 persons per month. William is married to his beautiful wife, Tia Francis, co-founder of Identity 3, a women's health organization, along with their chocolate Havanese dog, Roxy Brown. They all call Atlanta home. In William's spare time, he loves horseback riding, kickboxing, and plays competitive men's softball. Let's welcome Mr. William Francis. Joining us to the stage at this time is David L. Massey, a motivational speaker who travels sharing his story of life beyond the diagnosis. He also works in public health in Atlanta, Georgia. David launched a national speaking platform through a strategic partnership with a nonprofit organization in Washington, D.C. The Black Women's Health Imperative, raising awareness and education in HIV and AIDS to more than 59,000 African American women. Through this partnership, the door was open for him to be featured at events such as the Stellar Gospel Awards, the Congressional Black Caucus, and the International HIV STD Conference Series. Through this work, he has been a part of cutting-edge developments in the introduction of PrEP, pre-exposure prophylaxis, as well as a subject matter expert on workshops surrounding condom distribution and the fundamentals of HIV/AIDS prevention, training, and implementation. Along with his life and business partner, David is a digital contributor to Pause Magazine, where he co-hosts Table Talk, a weekly online vlog. As well, he is co-founder of Driving Out the Stigma, a grassroots HIV/AIDS awareness initiative geared toward the HBCU, or Historically Black Colleges and Universities, demographic. David's unwavering commitment to enlightening others, his professionalism infused with wit, and his determination to live life out loud has garnered the attention of nationally recognized organizations such as the HRC, also known as the Human Rights Campaign, and the Magic Johnson Foundation, where collaborative synergies are being explored. As an advocate connecting with various audiences, he hopes to educate while addressing the stigma still attached to those persons living with HIV and AIDS. Ladies and gentlemen, please welcome David L. Massey. Last on our stage is Kathy Doyle, also known as Kat Doyle, who's a certified lay ecclesial minister, currently the director of Justice and Peace Ministries for the Roman Catholic Archdiocese of Atlanta, where she staffs the Archbishop on matters of social concern. Prior to that, she has worked as a pastoral associate, director of parish life, and director of justice and outreach ministries, as well as being a youth minister for 10+ years. Some of her specific areas of social ministry focus on HIV/AIDS, care for creation, veterans and military justice, immigrations, human trafficking, poverty and homelessness, war and violence, and racial issues. Mrs. Doyle sits on the national board of the Roundtable Association of the Catholic Diocesan Social Action Directors, as well as the Archdiocesan Deaconate Formation Advisory Council. She studied industrial design at Auburn University and theology at Spring Hill College, Atlanta. She is currently pursuing advanced social justice credentials with the University of Dayton, with an emphasis on social ethics. She works to inspire all people to move towards greater social responsibility through transformative relationship-based actions. She is a gifted storyteller who shares her global relationship and peace-building experiences, as well as her everyday human encounters with warmth and affection. Please help me to welcome Ms. Kat Doyle. Along with our panelists on the stage this afternoon, we also have a wealth of resources. That are also on the floor that will be joining us during our question and answer session. And those individuals include Teresa Bell, if you'll stand. Teresa Bell. Okay. Emily Brown. Thank you for joining us. And Dr. Charnel Miles. Thank you so much for joining us. All right. At this time, we're going to begin our discussion. We're going to ask that you please hold all questions for our question and answer session, which will happen toward the end of the panel discussion. Are we on? Good.
Does he have questions?
Okay.
Oh, okay.
So our first question is going to the panel. And the question is, why are the rates of HIV so prevalent in Fulton and DeKalb County when we're comparing it against the rest of Georgia? Who'd ever like to start?
Well, I'll break the silence, which is what we're supposed to be doing today, I heard. So, you know, let's talk first about Georgia, because Georgia has the second highest rate of new HIV diagnoses in the country. Okay, so we used to think about the epicenter of HIV being New York, San Francisco, but now it's us. So, speaking of Georgia, it's really the metro Atlanta area that does have the highest rates of HIV, but HIV is everywhere in Georgia. And I think what we have to recognize is, sitting here in the South, we have a lot of challenges that are not specifically about HIV, but they set a fertile ground for HIV to grow, and they include, number one, stigma, racism, poverty, you know, lack of insurance. We have a high rate of people who are not insured, and our state has decided not to expand Medicaid. We have a terrible housing problem here. How can you care about anything else if you don't have a roof over your head? It's hard to get transportation. It's hard to go to a clinic when you can't get transportation. It's hard to get off time to go to a clinic when you're poor and you work hourly and you don't have vacation. We put a lot of barriers in between care and people. So I think we have a situation that is ripe for HIV. Dr. Ron Baldessari once said HIV never saw an inequality that it didn't like. And so the good news is we can do a lot of great things to treat HIV. And if people are well treated and their viral load is undetectable, they do not spread the virus, okay? Undetectable is untransmittable. We have PrEP, which has been talked about to keep people from getting HIV, but our challenges are education, awareness, and getting these services to people. And I'm gonna say it again, stigma, because that is probably our biggest issue right here in the South, in Fulton County.
Can I just say?
Yes, please.
The other thing that I would add to that is that people come into Fulton-DeKalb from outlying areas to receive care because, you know, in part our healthcare system here is not well developed. So in order for me to access an HIV specialist in an outlying area is very difficult. So if we think transportation is difficult within Fulton-DeKalb counties, go to an outlying area and you really can't you don't have adequate access to those services. So I think the other thing is that people are coming into the area to get care.
And I would just say that I think the rates are high because we're only treating the HIV and not treating the person. So going back to what you said, yes, undetectable is untransmittable, but it also for many means unemployed, uneducated. There's a whole lot of other uns that we could talk about that we don't address because we feel that our job is just HIV. We forget to focus on the person, which comes up with the social determinants of health, social justice issues, et cetera. So I think we have to do a better job of treating the person and not the disease. And as Ms. Ralph said earlier, then we also have to deal with our dis-ease in dealing with people as well.
Thank you.
If you ask about why Fulton and why DeKalb County, I would also ask you to consider that this is an area where the poor and the marginalized are sometimes stuck, but oftentimes pushed into those areas. So it is almost an artificially high number that we've created by pushing them into this urban environment that does not allow them oftentimes to be who they can be because of the stigma and because of that marginalization or that poverty label that they've been given.
Right. So universally, one of the things that I've heard as each of the panelists has spoken has been in some way, shape, or form about stigma, which leads to our next question. What are the top 3 stigmas of HIV that contributes to the spread of this virus amongst our people ages 13 to 24?
Well, let me just tackle one of those. I think in that age group, there's still a mentality of, it can't happen to me. It happens to other people that I know. It happens on television. It happens in the movies, but it doesn't happen to me. It doesn't happen to me, and it doesn't happen to people that look like me. It doesn't happen to people that sound like me. It doesn't happen to people that go to the same school that I go to, the same church that I go to. So if it's not happening around me, it can't happen to me. So that's number one. I think another one is that they have this invincible mentality. Not just that it can't happen to me, but that if I have it, then because I got it the way I got it, I deserve to spread it to somebody else. When we have instances and we have events set up to where people of that age range are going into hotels and they're going into homes, private places, just to get HIV, that's a problem. Because they only see it as what the media is portraying it to be. Yes, you can live a long life on medication. Yes, there's Magic Johnson, and he's an athlete and he's had it for 30 plus years. But it's also those of us who are living with the virus that is still not saying to that age group, I have this. This is something that I have, but it does not have to be you. It doesn't have to be you. It does not have to be you. In order to get where you want to go, in order to get where you need to go, you probably need to be around people that are like me, that don't have a problem or a fear with saying that this is what I have and that it doesn't have to be you. So that's just 2 of the 3 that I thought we should have been addressing.
Again, we're talking about what are the top 3 stigmas when we look at HIV that contributes to the spread of the virus, specifically amongst those ages 13 to 24.
In my work, I think the one thing that I face, and I would have to say that the community is guilty of this with the various campaigns, is we constantly say that it's a MSM bisexual men's issue. We tag it as young, and that makes it hard to involve the whole community. And that has been my ministry, to bring the community together. So I hear a lot of times, well, in the gay community or in the trans community, or this is happening in the faith community. We're not separate communities, we're one community. So I think that has been somewhat of a challenge for me. And then, as my brother said, self-stigma plays a very huge part. We talk a lot about stigma, what society places on me, but then there's a lot of issues with what I place on myself as an HIV positive individual that I don't think gets addressed enough.
Another one of our panelists.
So I want to mention a different kind of stigma, and that is a structural, legal kind of stigma. And I think this is something that we need to recognize as part of the atmosphere that creates stigma for all people, but I think younger people are particularly vulnerable. So Georgia is one of 33 states that criminalizes HIV. So in Georgia, you can, if you have HIV and you fail to disclose HIV to a sexual partner, you can be put in jail. Even if no HIV transmission occurred, even if there was no risk of HIV transmission, because your viral load was undetectable, or maybe use a condom, or whatever. So it doesn't really matter. These are outdated, scientifically inaccurate laws, but they give the message to people that there is something wrong with having HIV and that you ought to be in jail. If you have HIV, you're a menace to society, and so on. And you know, these laws need to be overturned. These laws don't prevent HIV transmission, and if they did, Georgia wouldn't be second highest in the country in terms of our rate of HIV. What do I need to tell you about laws not working? They don't work. But there was a meeting this morning at the Gold Dome, our state capitol. I wasn't able to attend. Emily attended. Some other friends who were busy texting me all during that meeting attended. And one of our lawmakers used the word quarantine about people with HIV.
Wow.
If that is not stigmatizing, if that is not going to keep people from going to get tested, why would you go get tested? If somebody wants to quarantine you, why would you go to care if somebody wants to quarantine you or put you in jail? You know, why would you want to get treated? Why would you take the risk of your HIV medicines being seen by your family or friends? So this business of structural legal stigma keeps people from knowing their status. It keeps people from being tested. It keeps them from being on medicines that can actually prevent this epidemic. And so I would say, make some noise with your representatives and let them know we need to overturn this law in Georgia. We need to modernize that law.
To kind of build on that, these 13 to 24-year-olds, like all of us, crave love, crave acceptance, and it is a very vulnerable time in their lives that if they choose to be tested and find that they are positive, that stigma of I will not be loved, I will not be accepted, I'm them, I'm no longer us. And that becomes, when we look at all the things we've talked about here, that's the underlying foundation of all of these stigmas, is that fear of not being loved, that fear of not being accepted. And every one of us in this room has to be held accountable for not letting that happen. We have the ability to take away that fear and to take away that stigma, and we are all called and held accountable to do that.
So I would say that, I won't name three, but I think that before we even get to HIV-related stigma, individuals are dealing with so many other stigmas and judgments and discrimination, et cetera, and they kind of build up to where you get to a point where you may become HIV positive. And that's added on to other stigmas that you deal with. You know, we live in an incredibly secretive, you know, kind of society, and we don't talk about things openly, and we judge people for what they think and what they do, and if it's different than what you think and what you do, and that's kind of how we get into these problems and moments where you're making decisions based on what you think you're supposed to do and how you're supposed to behave. So I think that long before people are HIV positive, they're dealing with a lot of different things going on. There's stigma related to poverty. There's stigma related to mental illness, substance use, even exploring sexuality. You know, we don't talk openly about sex in this society. I mean, it's in videos, et cetera, but we don't have, you know, healthy conversations about, with young people, especially about, you know, that it's part of being human to be sexual, right? So I think that there are a lot of things that build up to kind of larger stigmas, but we have a lot of things that we hide and we don't tell the truth, you know.
But in that age range of 13 to 24, there are two places that age group should be able to go to when they can't go to anyone else.
Right.
That's their parents. So if you are a parent and you have someone in that age range living in your home that you birthed, that you foster, that lives, that you provide for in your home, we're talking to you. You are one of the reasons why the stigma exists. Because your children can't talk to you. Because they feel like you won't understand them. So that's why we're here, to make sure that when they do talk to you, that you can understand them. Another place where they should be able to go when they can't go anywhere else, which is where the Black people seem to go anytime they're in crisis, is to the church. But if the church, so if you're clergy and you're here, your members in your congregation will not come to you because they feel like you won't understand them. They feel like you will judge them, that they are now deviant because they have this. You are a part of the problem. We are here to make sure that you now have no other excuse but to be a part of the solution. We're here to provide solutions, especially to those of you who engage with that specific age group of 13 to 24.
I think when you have a 13-year-old and mom's 26, grandma is 39, and great-grandma is 52. Great-grandma didn't know, grandma didn't know because they didn't pass it down. So a lot of times you see that trauma that, then goes from, I have a lot of thought now, which I always fought as a youngster. I think a lot like my grandmother because she raised me. So there's certain things. Have you ever heard the story of how it was passed down from generation to generation to cut off the tips of the ham and put it in the pan, and then finally the youngest child asked the oldest member of the family, why you cut off the tips of the ham, how does that help the recipe? And great-grandma just says, because it wouldn't fit in the pan. But it gets passed down. I preach it. I preach it better than I just told it. Said, but we do certain things, that come down. So I think that there is much validity to what you said. But in the communities that I serve, I'm really dealing with 26-year-old moms of 4 that weren't told by their mother or whatever. And then there's other issues that we have a young lady that's doing sex work now. Well, it's not because, I woke up and I want to do sex work, because she is working, but she's trying to feed her children. So we have a lot of other issues. So we do testing on a regular basis at our church. And, we don't want her to become positive, but we have to do stuff to get her out of the sex work, to get the income up, to, improve we have to do all of that, or we're just going to be, you were diagnosed with HIV. Well, that's a side effect of some of the things that go on, within our community. So, it ain't everybody in the room.
As we're talking, one of the things that we kind of shared in the green room, you shared, Ms. Doyle, and Mr. Massey shared, and Reverend Francis, we're talking about kind of the work in the community and what you do, and you shared about taking the children, bringing the children into Atlanta, into the city, so they could experience face-to-face those who experience homelessness and what it's like to be out there, that sort of thing, and continuing that work. One of the questions kind of comes up, and I'd like to gear this question towards Emily Brown in the audience, is, and certainly our panelists can take part in the question as well, is what would you tell young people who are in high-risk groups for HIV? And get her the mic.
So I unfortunately, or fortunately maybe, have the honor of speaking with youth in that high-risk group. And the first message I have for young people is the things that you're doing are normal. Your relationships with your loved ones, your family, your sex partners, whatever it is, those are real valid things. Those are part of humanity. And this is not an epidemic about behavior. You're not doing anything differently than any young person your age in America is not doing. The differences are not in behavior, they're in outcomes. And so I want you to protect yourself because you're more likely per unit of risk behavior to encounter HIV, not because you're a different kind of a person with different behavior who makes bad or different choices. Right. When I was 16 years old, I I went to the doctor and I was scared out of my mind. This is very personal. And I asked for an HIV test. It took me months to work up the courage to do that. And she said to me, "Why do you want an HIV test? Are you promiscuous or something?"
Right.
And obviously, several years later, I haven't forgotten that. So the way that we talk to young people matters. Asking them for their opinion matters. Coming at them, assuming that they're making quote unquote bad lifestyle choices, that's not going to help us at all.
Right.
So I trust young people, and it's normal to want to have sex.
And if we're going to have conversations with stigma, we have to stop using the term high risk. I mean, that really bothers me. I did a session 2 weeks ago, and there was a single young lady. I took her through the whole process of how we met, taking her to the nice restaurants, et cetera. We eventually had sex, and she never felt at risk. But I'm also HIV positive, and that conversation never came up in this particular service. So when you hear high risk, nobody goes out and puts themselves at risk. I didn't wake up that day and decide. I mean, I had been in a relationship with this person for a while, but because we weren't at high risk, the conversation never came up. And we keep labeling stuff. We say we want to end stigma, but then we re-stigmatize the disease when we say it's an MSM issue or whatever. If you are having sex, if you are doing this or doing that, then we are all at risk. We say in the church, by the grace of God, there go I. We've all done some stuff, if we want to be honest. Ain't nobody raising a hand, but we've all done some stuff. If we still ain't raising a hand, but y'all have all done some stuff. And we don't, and I think we have to get away with, this high risk label, because for many folks, I mean, I wasn't at high risk. Community didn't talk to me. Heterosexual male, I was in a relationship.
So along with the message about, as you shared, Ms. Brown, about talking with young people, different things like that, I want to talk to Dr. Miles. And Dr. Miles, we wanted to ask the question of, as a youth-serving organization who provides behavioral health treatment to youth and young adults, those affected by sexual assault crimes, and we understand and know the sex trafficking and different dynamics that are here in Atlanta, what is your approach to working with those who are newly diagnosed with HIV?
So I will share my approach, but I was sitting here and actually listening to the panel and kind of taking notes as I normally do. And I had a couple of thoughts because I knew a question was going to be coming to me, but I have to say, as Ms. Ralph said, we have a problem. Because oftentimes, when you talk about child sex trafficking, people will quickly say Atlanta is #1, right? Over the 20 years, just about that I've been a trauma specialist and working with individuals who have experienced sexual assaults, primarily children, people don't generally talk about the stats as it relates to children, child sex trafficking, and HIV. But it happens, and we see it. And I started to say, if any of you have heard of stats when it comes to children, HIV, and child sex trafficking, just kind of raise your hand for me. About 5 people. But if you heard that Atlanta was #1 with child sex trafficking, raise your hand. That's a problem. We are at Youth Spark, where I'm the oversee clinical programs. We actually work with some of Atlanta's most vulnerable children. And when our children come in within our youth center down at Fulton County Juvenile Court, we approach the child, we approach the family from a trauma-informed perspective. And this is very important, not only because their child may have behaviors which makes them vulnerable to child sex trafficking, but we also consider the family. We have families whose parents are HIV positive, And not only does that make the child vulnerable in some aspects, when you couple it with the child's behavior, the child running away, the child having multiple sex partners, the child not being educated about HIV, and I heard one of the panelists talk about we have to do more education. But we treat them and we hold their hand from a trauma-informed perspective. So what does that mean? We start from assessing what's going on with their child. And we don't just talk about what brought you into the court. We ask your medical history. And unfortunately, we have had youth who are involved with the court who are HIV positive. There still remains a lot of gaps. Sometimes after the youth is newly diagnosed, that youth will go back on the street, they will run away, they don't receive treatment. I was sitting here and while the panel was enjoying your lunch, I was sharing a story about a young lady who I had to call in a favor for her to get PrEP. I should not have had to call it in a favor, right? That should have been automatically given to that child who was rescued and going on her way to go into a safe home. So again, it goes back to access, it goes back to education, it definitely goes back to collaborating with community partners such as Georgia Equality and other great community partners, but that is something that we at YouthSpark, we're working at every single day because all of our youth are at risk. Specifically our girls who have either been sex trafficked or have those behaviors which makes them vulnerable.
Thank you so much. Thank you so much.
Can I add though, and I love what you're saying, and I think that if you asked a lot of us, what would we say? One of the things we would say is that let's get our youth talking to each other. That means we have to not just educate and talk to those who are HIV positive, but we have to talk with all those, not those just at risk. We need to educate all of our children because go back to what I said before, if you're afraid you aren't going to be accepted or loved, those kids that have been handed down these ideologies from their parents, these stigmas from their parents, may not understand or realize how they can make a difference. So I would say, let's get kids talking face to one another. That's going to hit us with education. It's going to begin to get rid of those stigmas because they see each other as real people and not some statistic or some story their parents have told them about or they've seen on the news.
Thank you so much. As we continue along those lines, we want to make sure that we create an opportunity for the audience and those who are here to also ask questions to our panelists and for our experts who are on the floor. And as you're preparing your questions, I also want to ask one final question from the stage, which is what resources are in the community for those who are living with HIV and AIDS and do not have health insurance? This is a very important question that I'm sure comes up quite often when we look at what resources are available, what funding is being cut, and the numbers of people that need to be served. So what resources are we aware of that can serve those who are without insurance?
Let me start by saying that we are very lucky as a nation that Congress created the Ryan White system as a public health intervention. And here in Atlanta, we have a lot of Ryan White clinics. We have 7 or 8 Ryan White clinics, the first of which was Grady, and the largest of which is Grady. But Ryan White clinics provide care for people who have HIV. They provide access to medications through a program called ADAP, the AIDS Drug Assistance Program. So if you have HIV and you're uninsured, you can get care. That care is free, it's available. And there are so many different places in Atlanta where you can get that care. Grady is a great place to start. Fulton County Health Department, DeKalb County Health Department, really all of our health departments have some access pathway for people who have HIV and are not insured. And we want to be sure that those people have access to drugs, have access to care. People who get care can live a near normal lifespan. So these are important resources for actually getting care and treatment. And I'll let others talk about other resources that can help people get to the door.
But with that resource and being a part of the community and always wanting to keep my thumb to the pulse of what's going on, with that specific program, one of the areas of improvement, because the question is, yes, that resource is available, but if it's not available to me when I need it, and it's not accessible to me, then it's not effective.
Exactly, right.
Right.
So the Ryan White program, yes, we have a program in place, but if you have 50 people who need to get into this program, and they need to get into this program now, before they reach another critical stage in their journey, then it's not as effective as we would like it to be or that we would hope it to be. So no matter what the resource is, if it's not reaching the people when they need to be reached, it's not effective.
And you know, I think that is so important. And I want to point out that the Fulton County Task Force on HIV/AIDS specifically addressed this issue of access as a very high priority for us. And one of the things that we said is that everybody who is diagnosed with HIV or who is presenting to a clinic after having been out of care ought to get a medical visit within 3 days or same day. And as a result of that recommendation, we have 6 clinics in Atlanta that have begun to test some mechanism for rapid entry. And that may mean getting a medical visit the same day you show up, and even getting on HIV treatment the same day you show up. So this is a sea change in how we deliver care, because the care needs to be client-centered, not centered around the institutional needs of our clinics. And so this is a really important thing that it's just beginning. It's not fully functional yet, but Fulton County's health department is beginning to make changes. Positive Impact Health Center has a rapid entry clinic. Grady did a pilot with a rapid entry clinic in the infectious disease program. So, and there are about 3 more. The VA has a rapid entry program. So I totally endorse what you're saying. We're not there yet, but we have to make our services more available to people.
But a lot of the changes that we're seeing are reactive, because we're talking about access to care.
Yeah.
The resources need to come before folks become HIV positive. So understanding that we have folks that work in the community, within the HIV community, but where are those that are providing quality housing? Where are those that are going to the school board and getting comprehensive sexuality education within our schools? Where are those that need to be in the room that work with, as we had talked about, 3rd grade going to prison, et cetera? Those people are never in the room. We talk amongst ourselves, we preach to the choir, and the choir is off tune. The choir is very off tune, because we constantly talk about, oh, we'll follow the epidemic, or you know, we need to do interventions based on data. Well, data has already happened. Leadership is getting in front of the disease, not following the epidemic. That's
right.
just, yeah, and we have to do better with that.
I actually want to throw out a call to activism here for people, because you mentioned comprehensive sexual health education. And one of the things the Fulton County Task Force on HIV recommended and followed through with is to work with the Atlanta Public Schools, with their curriculum committee, to actually get comprehensive sexual health education that is science-based and not discriminatory or judgmental into the Atlanta Public Schools, and that actually is happening. Fulton County Public Schools, however, have not made that leap yet. And so I would invite all of you who have children in the Fulton County Public Schools, or you're a citizen of Fulton County, reach out to the superintendent of schools in Fulton County and let them know we need to educate our children in a non-judgmental way to take care of themselves and to regard their sexual health as a positive thing. So I think, you know, I'll just leave that there for your activism list that you're going to take home today, because I know you are.
Absolutely. We want to create just a little bit of time for, I think we have time for one question. From the audience is what I'm being told. I'm following the floor. So if there's a person with a question from the floor, we want to capture you. If you'll raise your hand, we have individuals with mics. So we want to be able to capture at least one question from the audience before we wrap up.
Who has the burning question?
Someone has the burning question. We just need to get to them. Right, this gentleman right over here.
Thank you, everybody. Great panel. Can you share a little bit about how you address issues of culture and language as a barrier for this information?
So the question was, how
That's
do
a
you
good
address
question.
issues of culture and language as barriers?
I can begin by speaking to that. One of the things we know in dealing with new cases of HIV is that it is becoming more and more prevalent within the Hispanic community. And as many of you might know, the Catholic Church by 2020 is expected to be 50% or more Hispanic. And so one of the things that we have really worked on is we reach out to the houses of worship within our communities, and not just the Catholic community, but our partner churches as well in the communities, is to remember that as we minister, we must do it in a way that we meet people where they are. That means that any literature that we put out, that any training that we do, be at least bilingual, if not more so. With a lot of the sex trafficking and the spread of disease that comes through that, we're also looking at heavy instances within the Asian communities, that Asian population and that culture, and a very different way of addressing those issues. I wrap all of that kind of in the idea too that when we talk about providing health care, we cannot forget the mental health care that comes with this as well. We talk about you have to have the medicine and you have to take it every day. The mental health care comes with that. Why do you have to take it every day for a 13-year-old is a really important part of that health care. So not only do we have to make sure we are providing that teaching, that knowledge, that expertise in whatever languages, we have to be aware that there are cultural differences. We get outside of the Christian community and into, let's say, the Muslim community, where the stigma is so much more intense and more different, and how we approach that is very different than how we would approach it with a young black man.
Thank you. Other panelists that would like to respond to that question?
So I would just say from a healthcare perspective, I mean, we have access to many languages at our clinic and throughout our hospital system, but it's not just about the language, obviously. It's more than that. It's understanding and being respectful of people's different beliefs and, you know, belief systems and culture. And I think that's the part that's even more important. It's about how you make someone feel when they come into your clinic. Is it welcoming, regardless of whether you speak English or you don't speak English, you know, whether you dress a certain way or another way. And so I think that's really important. But the language part is almost the easiest part of it. But, you know, having some deeper understanding of cultural differences is I think, what's most important.
Thank you. We'll take one more response from the panel.
So I would just like to mention that when you ask about care for people with HIV, if they don't have insurance, I also want to say that we have care for people with HIV if they are immigrants to this country and lack documentation. And you are not going to be turned away from Orion White Clinic because you are an immigrant and do not have documentation. So this is really important because so many people are here and afraid. And particularly in this environment politically, they are so afraid that they don't get health care when they really need it. So I think that's just something important for people to know, and that's whether you're Hispanic, whether you're Asian, whether you're from Africa, it doesn't really matter. You can get health care here.
It's up to all of us to leverage those cultural networks. So if it's not just about us knowing, but we have to take the information we've learned today and we need to push that out into those cultural networks, because that's where information is going to get to those people that need it.
Great. So we're going to creep in one more question really quick.
Just a quick question. I have, and it's for Lisa Rowland. I wanted her to answer for us how opt-out screening have impacted the states who are able to show decreased incidence of HIV incidence.
Well, I mean, that's a great question. So I worked in New York State, and they have opt-out screening, and the impact has been that they identified.
I'm sorry, Ms. Rowland. Will you explain to those who may not be aware what opt-out screening is? Would you
Oh,
explain?
I mean, it's a routinized process for testing where you don't have to consent to a test. It's done automatically unless you say you don't want it. So it's a part of, it's integrated into healthcare, you know, in general. And the impact has been that, you know, places where they do routinized testing and opt-out screening is that they're identifying individuals much earlier in their disease progression, which is huge because in Georgia, when we identify, I think in our focus testing, which is testing in our emergency department, about 50% of the individuals who test positive already have full-blown AIDS. So we're not identifying people early enough, and I think it's a really important strategy for prevention, early detection, et cetera, and it's something that we need to kind of push on a political and advocacy level here in Georgia. So I think that's a great point.
Thank you so much. We apologize that we weren't able to get to some questions, but we'd certainly like to thank our panelists. And we'd also like to thank our experts on the floor. Thank you so much for joining us. Well, it's been my pleasure to serve as your MC and your moderator. Thank you again to our panelists, keynote speaker, Ms. Cheryl Lee Ralph, and you, the audience, for making this an informative and impactful experience. I will now turn this program over to Dr. Josh Murphy, the Fulton-DeKalb Hospital Authority COO, Jasmine Curry, Outreach Coordinator, and Sherrod Polite, Health Educator for the special giveaways, followed by the Fulton-DeKalb Hospital Authority Chairman of the Board, Thomas W. Dortch Jr., to give the closing remarks. Thank you all again.
I think we can leave.
I'm going to, oh.
Okay, everyone get your raffle tickets ready? All right. Let's roll it. Let's roll it. Okay, first ticket number is 9966479. And this is for a Chick-fil-A gift card, which is ticket number 9966473. Okay. For the same gift card, it is 1408186. All right. Okay, we're going to do the last three numbers. Okay, this is for a Hyatt complimentary 2-night weekend stay at the Hyatt. Okay. All right, and the last two numbers are 227. 227. Last three numbers. Okay. All right, we're going to do last three numbers again. Last three numbers are 394. Let's keep it rolling. 209. 354. 20. Okay, all right. All right, thank you. Wait, one more? Okay. This is the fifth. Okay, give her the fifth. Oh, no, okay. There you go. All right, for the last prize, we have a Fitbit Flex 2, 371. I said 166. We have a 167. Let's see, 431. 390. 348. 152. She was waiting on that. Okay. All right, congratulations. Thank you. Okay. All right, now we have an HP laptop. All right. All right, let me get my ticket out. Okay, we have 353. 183. 219. 452. 462. All right. Go. All right, thank you very much.
Let me stand and say thank everyone for hanging around and being a part of the 6th Annual Health Summit from the Fulton-DeKalb Hospital Authority. I have the distinct honor and pleasure of bringing to the podium none other than Thomas W. Dorsch, Jr., the chairman of the Fulton-DeKalb Hospital Authority. Come on up, Mr. Dorsch.
Let me thank all of you for staying the day. Next year, we're planning on having this conference on a weekend so that not only will our practitioners be able to join us, but the target community that we think is very important to be in the room with us. It's like going into a doctor's office. How can you walk in a doctor's office and say, treat me, without knowing what the symptoms are? And we are practitioners. We need to have those people who are impacted in the room with us. So next year we will be looking forward to a weekend where more people can engage and be involved. I want to let you know to keep a lookout on our website. We always do follow-ups. We don't just do this as a one-day conference and then we leave. So we will be doing a follow-up forum in DeKalb County and in Fulton County. So we want to make sure those of you who are registered, you will receive direct notification. And we hope that you will join us and be a part of this effort. This is our 6th year. And one of the things that you'll know is that we pay for 100% of the cost for these conferences. You shouldn't have to pay to come and get educated, come and network and learn how we improve our communities. And so from our endowment funds, we pay 100% of the cost, along with our partners who do come in and support us as corporate partners with this effort. And I want to thank all of them for their investment into ensuring that we're working together for healthier communities. I want to thank our co-chairs, the dynamic trio. Of course, Dr. Annette Bernard has been at this, and Dr. Sharon Hartley have been at this every year. I want to thank the two of them, and we decided they'd uplift Dr. Sultan Sims, and so we added a little male in the middle to work with the dynamic team. So let's thank again our co-chairs. and we have something for our co-chairs that we want to present to all of the community-based organizations and agencies who worked with us over the year to prepare for this day. We want to thank you, our partners, our grantees. We will start, we'll catch our breath for maybe a week, and then we'll start right back planning for 2018 because we see this as being important. The Fulton-DeKalb Hospital Authority, even though we own the Grady Memorial Hospital system, we want to keep people out of our emergency room, and the way we do that is prevention, early detection, early treatment, and rather than seeing people in our emergency room, we want to make sure you get the treatment early and have a longer and expanded life. And so we want to continue and will continue to make these kinds of investments. We give over $1 million a year in grants to community-based organizations in support of their efforts, and there are some phenomenal organizations. I don't know if we have any of those partners here, but those that are still here, please stand. We want to say thank you to the grantees for all that you do and making a difference. And these grantees reach well over 150,000 people a year from screenings and all. So we want to thank you. And I, again, my board, many had to leave. They're lawyers and doctors, and I got two of the best doctors in the universe sitting here. And of course, you know, while I have all the insurance in the world, I figure I'll call up the best and even get some advice from them, and they tell me what to do so I don't have to go to my doctors. So I want to thank them, and I want to thank our staff. Phenomenal team that we have that work every day. I want to say thank you, all of our staff that are here. Thank you, and the interns. We thank you for all that you do and what you've done to make a difference. And last but not least, while we talk about the fact that we own the Grady Health System, we have one of the greatest teams of doctors and practitioners in the Grady Health System. The clinic, again, is one of the best in the nation in our HIV clinic, and they, again, take care of citizens. We are now curing hepatitis C. And if you're enrolled in our program and we're trying to know what the status, those drugs that cost over $100,000, we give them free. And we're curing hep C. We just need to know our status. And so all of that said to you, we thank you for being here today. Don't let the dialogue end at the end of this session. We have to continue to communicate. We have to continue to work. We want you in our various forums that will follow. And if you have a great idea about something we ought to do, let us know, because we're investing in the health and in the improvement of lives, quality of lives for our citizens in Fulton and DeKalb. But the one thing about Grady, no matter where you live, unlike many of our other institutions in this city, Grady will take care of you no matter whether you have insurance or money to pay. Grady will take care of you no matter where you come from in this state or in this country, because it lives up to its creed of making sure that we provide for those who walk through our doors. And so with that, here I am 10 years later from the day I went in with the chamber when they asked the chamber members for us to come and do an assessment of Grady. 10 years later is one of the greatest and strongest hospitals in this nation, and Grady will be here. And not only can Atlanta Atlanta can't live without Grady, but we're going to tell you over the rest of the month and years why Atlanta can't live without Grady. Thank you for coming out today.
All righty, we have one last presentation that we'd like to make. Each year, the team and I have been going through these summits for about the last 6 years. But the brainchild of this summit was our very own Mr. Thomas Dortch. So many times, you work for bosses, you have to beg for things. But Mr. Dortch, from day one, when I walked through this door, said, we will serve the community unconditionally. Otherwise, we'll all be fired. So we just want to give Mr. Dortch a small token of our appreciation for all of his work, year after year, bugging him half to death about, can we please have this, can we please have that for the community? He always says yes. Well, that's next year. So thank you, Mr. Dortch. Yes, yes. And so thank you so much, Mr. Dortch. Please join me in giving a round of applause for our chairman.
Thank you.
You're welcome. Thank you. And again, thank you and have a wonderful week.